Hello, my name is Debra Hogan, and I am a nurse with Florida Department of Health, Palm Beach County, with a specialty in public health nursing. I'm actually a registered nurse, and I work every day to immunize children, give them vaccines that will protect them against diseases. Today, we're here with T. Leroy Jefferson, working to immunize kids to get them ready for school. And the shots that kids need for school protect them against diseases that spread when you have large groups of people together. So that's why the schools require these vaccines, and as a public health nurse, I work to give those vaccines to the children. These days, you don't have to get sick. Vaccines actually protect you and keep you healthy. Nurses do many things. I work in public health, so my goal is to keep people, adults and children, healthy, and that involves giving vaccines. But they do other things. We see nurses or see people in maternity clinics. We have people who come in for treatments. But our goal is overall to help people stay healthy. My background, I was born in Washington, D.C., which is, of course, our nation's capital. I was raised as a Navy child, so we moved around a lot, and lived outside the country as well as a number of places inside the United States. When I went to school, though, I went to school in Mobile, Alabama, and I got my registered nurse diploma at the Maston School of Nursing. I decided to go back for further studies and went and got my Bachelor of Science degree in Augusta, Georgia, at Medical College of Georgia, and then later went for my master's degree in public health at Tulane School of Public Health in New Orleans. So as a child, I moved around a lot, and as a student, to learn more about health and public health, I moved around a lot also. Where do I work right now? It's here in West Palm Beach. I work for the Florida Department of Health, and I am the program manager for our immunization program. I work with many dedicated people, nurses, doctors, clerical staff, who reach out to the community and provide vaccines in the community. And like I say, we're here today working with other great community groups to partner and provide services that the community needs. We've worked with T. Leroy Jefferson for probably 7 or 8 years, and are very proud of our partnership with the physicians from that group. Along their physicals and our immunizations, I think, protect a lot of children here in our county and help you get ready for school. What does a typical day look like? Well, we have our clinics. We see our families that come in. We get calls. I do classes. We teach other nurses. We certainly teach the families that we work with, and I work with community groups and other nursing programs to educate nurses too. Immunizations are a much more complex field than before. We have a lot of great immunizations that people need, and so we need to learn more and more about them. What inspired me to be a nurse? Actually, my mother was a nurse, so it seemed kind of natural. I really appreciated the fact that she cared a lot about people. She took good care of us, and also cared about people that she saw, trying to help them to be feel better, be healthier. So that's what started. When I went into public health, though, what inspired me there, I worked in a hospital. I worked in intensive care nursery with babies that were born with very, very severe diseases and conditions. And in my mind, I had not had any public health experience, but I had to think there's got to be something we're missing here, that these children could have a better start than this. So I went back to school. That's what inspired me to go back, and entered public health and learned all about prevention and health promotion, and those things that for those babies would make a difference. So I started in public health about 40 years ago, and that's where I've stayed. There's so much we can do to encourage people, to teach people, to help them do what they need to do to stay healthy and to meet their health goals. So what do you need to do as a student? Well, I would really encourage anybody to enter the medical profession. If you really want to help people, and also if you want to learn and know that every day you're learning something and you're achieving something, then the medical field is there for you. It's something that you do learn every day, and when you'll even find something that you have to research that day. So it's a constant learning initiative, a constant improvement, but you meet fine people, wonderful clients, and really enlarge your scope of practice, whatever you do. And certainly the field of public health is a very important one, because that puts people in charge of their own health, and that is going to make us a healthier nation and a healthier county. So invite you to go into nursing school, to go into medical school, join us as a healthcare professional.